Okay, welcome everyone. Bienvenue tout le monde. I'm Dr. Mary Bartram. I'm the Policy Director with the Mental Health Commission of Canada, and I'll be your host today. Before we get started with the webinar in earnest, I'll just review the technical details regarding webinar participation. So we're pleased to be offering the webinar in both official languages. Today's webinar will be presented in English and simultaneously translated into French. To listen in French, click on the interpretation button at the bottom of your screen and select your preferred language. Closed captioning is also available for the webinar, and you can access this through the live transcript button at the bottom of your screen. To view the presentation slides in French, select View Options at the top of your screen, and from the drop-down menu that appears, you can toggle between the English and French by changing your selection under the heading Shared Screens. I'll be moderating a Q&A period at the end of the panel presentation. Please feel free to type in any questions for the presenters in the chat box. Finally, considering the topic of the presentation today, please do not hesitate to reach out to your local crisis center or distress line for support if you feel that you need it. We'll also provide additional information regarding supports in the chat. If you experience any technical difficulties at any point, please let us know either through the chat or you can call, and this will be in the chat, Sam at 418-999-8274. Okay, next slide, please. So again, I'm Dr. Mary Bartram. I'm the Policy Director at the Mental Health Commission of Canada and an adjunct professor at Carleton University School of Public Policy and Administration. And we are very pleased to present the key findings and recommendations from our recently released policy brief on COVID-19, mental health, and substance use in correctional settings, and to welcome our guest panelists and all of you as webinar participants. Next slide, please. The Mental Health Commission of Canada operates primarily on the unceded traditional territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. The Algonquin people have lived on this land as keepers and defenders of the Ottawa River watershed and its tributaries, and were privileged to benefit from their long history of welcoming many nations to this beautiful territory. And we also recognize the traditional lands across what is known as Canada, on which our staff and stakeholders reside. We'd also like to acknowledge the pain and loss felt by the families and communities of the Indigenous children found in undocumented and unmarked graves on the grounds of former Indian residential schools. Please join me now in a moment of quiet reflection. Okay, thank you. Next slide, please. Here's the agenda for today. I'll introduce the panelists after providing an overview of the key findings and recommendations in the policy brief, and then open it up to Q&A following the remarks and reflections from the panelists. So on the next slide, you can see that there are two documents that we released. You can find them at the link that will be provided in the chat, as well as on the slide, I believe. There's a longer version on the left and a 2-page highlights version that's available in both documents are available in both French and English. So next slide, please. So I'll start now to provide a brief overview of the policy brief. First, here's how we went about it. Back in March 2020, when the pandemic was first beginning to hit, we conducted a preliminary scan of the potential impacts, the potential mental health impacts of the pandemic, and that we'll provide a link to that in the chat. And one of the issues that we flagged was the potential impact for the pandemic to have particularly strong consequences for people who went into the pandemic with a higher concentration of mental health risk factors. And as a result, we embarked on a series of policy briefs zeroing in on some of those populations, including people experiencing criminal justice system involvement. In addition to reviewing the emerging literature from academic and other sources, we worked in collaboration with a group of expert advisors, including Howard Sapers, who's joining us on our panel today. We engaged with key federal departments to get their feedback and input. And we also held a really critical focus group to center the report in people's lived and living experience. And you can see on the next slide some of the key quotes that came out of those focus groups. These quotes really reinforce how the COVID-19 pandemic heightened anxieties and also exacerbated some of the gaps and challenges in services and supports and risk factors in correctional settings. Next slide, please. So some of the key themes and findings that emerged from the research and consultation that we did. People in correctional settings often face intersecting stigmas, including the stigmas related to criminal justice system involvement, but also mental illness and substance use, chronic disease, which make it difficult to access the services that they require. At the same time, the very nature of correctional systems has made it hard for facilities to adhere to public health guidance and maintain continuity of health and social programming. And together, these factors have really put people experiencing incarceration at disproportionate risk, not just of contracting COVID-19, but also of intensifying pre-existing mental health and substance use risks. Next slide, please. Here's some of the key facts that we identified. First, that COVID-19 infections were higher in federal provincial correctional facilities relative to the general population. Second, that people who are experiencing incarceration already went into the pandemic with elevated rates of problematic substance use, which is linked to greater susceptibility for COVID-19 infections and complications. And lastly, according to the Office of the Correctional Investigator, in order to implement public health measures, this meant that some people have been kept in their cells for 23 hours a day due to lockdowns and restrictions, and the mental health consequences of that are front of mind throughout the policy brief. Next slide, please. Some of the key challenges that we identified. First, that people experiencing incarceration have a higher risk of contracting COVID-19, as we saw from the statistic on the previous slide, and that this is partially the nature of correctional settings, but partially also a higher concentration of pre-existing health conditions, and also really linked to equity issues, that the higher disproportionate number of racialized and Indigenous people who are in the criminal justice system, and the risk factors for chronic disease and for mental health and substance use that are also disproportionately felt among those populations. You can see this just sort of compounding nature of the COVID-19 risks with some of these pre-existing risks. And frankly, the heightened risk of COVID-19 as it has across the population as a whole, that fear and anxiety of contracting the coronavirus is something that has had a particular effect in correctional settings, particularly for people who came into the pandemic with pre-existing mental health issues or substance use concerns, which we know were already elevated within the population of people experiencing incarceration. And then third, that COVID-19 has added to and exacerbated longstanding challenges with service delivery in correctional settings. Similar to outside of correctional settings as well, we've experienced service disruptions in the mental health and substance use sector that really exacerbated in correctional settings, including issues related to staffing. Next slide, please. Some of the key considerations that are identified in the policy brief. A really important one, that medical isolation should not be set up in the same way as solitary confinement. So of course, medical isolation was a necessary approach in terms of following public health guidance. However, really difficult to avoid the association with solitary confinement or administrative segregation. And we've seen reports that in some cases those settings were used for medical isolation, for example, and just the importance of doing everything possible to implement medical isolation without invoking context and approach as solitary confinement and administrative segregation. Secondly, the importance of decarceration. We've seen that decarceration efforts increased during the pandemic, but then lastly, really highlighting the importance of strengthening discharge planning and continuity of care. That there were some critical gaps that were exacerbated as a result of those decarceration efforts. So as we move forward, the importance of addressing those gaps has really been driven home by the experience during the pandemic. Next slide, please. So I'll just end with some highlights from the policy recommendations, and certainly there are more within the comprehensive report that you can also view. So the importance of COVID-19 screening and reporting universally for staff and also people who are incarcerated. Vaccination, also a critical issue and an important one now and going into the fall. The importance of transparency and information sharing around infection prevention and control measures and mental health and substance use impacts to further strengthen transparency in those domains, and also the importance of integrating substance use services, including harm reduction. So both within and within correctional settings, but also as part of the discharge planning and continuity of services for people coming out of correctional settings into the community. And lastly, the next slide. So as I mentioned, this issue of medical isolation is really critical. The importance of oversight and clear justification to guard against potential misuse of medical isolation in this context, given the association with administrative segregation or solitary confinement and risks of human rights abuses that are associated with those approaches. The brief calls for a national correctional decarceration strategy to be developed. Again, as I mentioned, this was really driven home during the pandemic, the importance of reinforcing and strengthening that transition. And integrating medical records into discharge planning, and also doing more to systematically collect gender and race-based data to enhance accountability and transparency and address some of those equity issues that I mentioned earlier, to increase funding for collaborations between correctional facilities and community service providers. And I think this can also be framed around the importance of integrating and aligning federal correctional services with provincially funded services at the community level, and ensuring continued access to medications, treatments, and supports. Housing being another key dimension as well. So I'll end there. And before we turn to the panel, we just wanted to touch base with the participants just to get a bit of a read on who is in the Zoom, as it were. So if we could turn to the next slide, and my understanding is that the poll will be queued up. There we go. So just asking for where people are calling in from, and also what your association and interest is with the topic. So we'll just give folks a bit of time to complete the poll and report that back, and then I'll move on to introducing the panel. All right, we're up to 47 of 78. Just give people 30 more seconds or so and move along. All right, going once, going twice. Okay, great. Thanks very much. If we could end the poll. All right, so we've got a big concentration of folks from Ontario and Quebec, but again, proportional to our distribution of our population. Great to see some people calling in from out west and from central Canada. And we've got one person from outside of Canada as well. So in terms of the primary identification, I guess you can scroll down. People with lived and living experience, a number of healthcare professionals and criminal justice professionals, which is great, researchers and policymakers. So a good mix. So we look forward to seeing what kind of questions come forward. Okay, next slide, please. So I'm just going to briefly introduce the three panelists, and also ask that the full introductions be included, or full bios be included in the chat. So first we're going to hear from Mo Korchinski, who's the Executive Director of Unlocking the Gates Society in British Columbia. And she has had a long history with substance use and incarceration, and her lived history and experiences have shaped the program into what it is today. She'll be followed by AJ Grant Nicholson, who's a lawyer and mental health and justice advisor with extensive experience in mental health related law, including mental capacity litigation, substitute decision-making, and mental health-related criminal law. AJ is also a policy advisor and consultant with experience developing large-scale justice programming for marginalized populations. And finally, Howard Sapers, who's the chair of the Structured Intervention Unit's Implementation Advisory Panel and the former Correctional Investigator of Canada. Howard's experience includes work in the justice, corrections, and political sectors, and he currently consults domestically and internationally on oversight, ombudsmanship, and correctional policy and practice. So without further ado, we've asked on the next slide our three panelists to reflect on these questions, which we can click through. And we look forward to hearing first from Mo. So over to you, Mo.
Thank you. So first question, why is this work important to you? Again, for me, you know, with my own personal lived experience of going in and out of the justice system, and so my work is around supporting people the day they get released. I work with all correctional centers in British Columbia, so there's 10 provincial and 9 federal. So my program works through the whole province. And for me, when I was in prison, it was the revolving door, people coming in and out, no idea where they were going when they were getting released. So we started a program what supports people 72 hours, and we walk beside them, you know, if they want to get clean or if they just want to go back to what they were doing, and just making sure people have safe drug supply, you know, Narcan kits, take-home kits. And for me, it's keeping people alive. You know, I've lost over 400 people I know from the overdose crisis here in BC. So yeah, so 13 years ago, we started this pilot project, and never in my wildest dreams that it would be, you know, first we started one little prison here in Maple Ridge, BC, the women's, and now we work with all men and women. So that's me. Want me to answer all of them or just the first question?
Yeah, if you don't mind, Mo, working your way through the questions, and then we'll kind of go around that way.
Okay, I think issues are good. Yeah, for me, I guess when COVID hit, I mean, a lot of the issues were just very more highlighted, especially we know about from one of our research studies, about 85% of the population coming out of our prison system are homeless and have no idea where they're going. Here they get a bus ticket back to where they're arrested, a clear plastic bag with all their personal belongings in it. What really has no dignity for somebody who's getting released. So we also have a backpack program where we give people backpacks so they can put their stuff in. And yeah, for me, it's, you know, with COVID, everything getting shut down, there was no buses, there was no nothing. And my organization as a team, I have 15 staff, we decided that we were going to continue working and supporting. We reached out to all the correctional centers and said, hey, we're still here. We're funded for 200 clients a year, and we did over 600 in the first year of the pandemic. So we're also funded by First Nations Health Authority. We're so grateful for their tribute to this work that we do. And again, our number one is keeping people alive. You know, through the pandemic, it was, you know, picking people up at the jail, and we actually did a survey and asking people questions about about COVID, but watching people come out after 2 months of lockdown and everything's, you know, it's like a ghost town, and, you know, the anxiety and the uncertainty where they're going. And, you know, they were so grateful that, you know, they had somebody to walk beside them. And I think it's so important that everybody who gets released has that extra support. You know, especially when everything was shut down, and the hardest thing was trying to find somewhere safe for somebody to go in the middle of a pandemic and an overdose crisis. For me, next steps recommendation is one of the ones you did: support community organizations that do this work. We're running out of funding. You know, like I said, we did over 600. We ended up housing over 250 people out of the 600. What's amazing is through a pandemic. But we definitely need more funding, as this year our numbers are even going to be higher, right? And, you know, all my staff all have incarceration experience. So we all know what it's like walking out those gates the day you get released, right? And how hard it is, right? For me, it's so much easier to go back to the street where you're supported and not judged, but having a staff who knows what it's like and give them hope that they too can turn their life around and have their children back in their life, or be a grandmother to their grandchildren, you know, get a job, right? They always say, how do I do what you're doing, right? You know, stay clean for a year, stay out of trouble for a year, and you're welcome to come and work with our organization. So yeah, I think it's just supporting these community organizations. So that's me for this question.
Thanks very much, Mo, and really hearing that, you know, the focus on better support for people who are transitioning back to the community, the dignity, the support for the community organizations that really connect in part through, you know, being able to offer that lived experience perspective and supporting people from that place to and then that role of housing, right? That like housing, basic dignity. Yeah, really, really appreciate that perspective. So, okay, well, if there's time, we can come back to you as well if you've got some thoughts after hearing from AJ and Howard as well.
Thank you.
Yeah. So we'll turn it over to you, AJ.
Hi, everybody. So I'll just go through the questions in order, just like we did with Mo. So why is this work important to me, and how did I get involved in this work? So I grew up in a household where prisoner rights advocacy was paramount. My grandmother, Beverly Folks, was the executive director of Black Inmates and Friends Assembly. And that was a nonprofit that provided programming and advocacy for Black and Caribbean incarcerated persons across Ontario. And I worked with her and was mentored by her in high school and through university. So it really inspired me to pursue a career in law. And so after law school and after articling with Legal Aid Ontario, I began my first job as a mental health staff lawyer. So I worked on the front lines as duty counsel in a forensic psychiatric hospital, and also in mental health court. And then after that, I moved on to working as a policy lawyer at Legal Aid Ontario, leading mental health strategy and helping to develop programs for justice-involved persons with mental health and substance use needs. And one of the things I've realized throughout the years and what I've seen is that the justice system is a really blunt instrument, not really designed to address the needs of persons with really healthcare needs, the therapeutic needs of those persons. We're seeing an aging population in prisons, so their geriatric needs. And then we're also seeing, because of this pandemic, how a lot of those needs and problems are becoming exacerbated and made worse. So in my current private practice, I do specialize in mental health law, and that does involve mental health related criminal law matters and mental capacity litigation. And I also maintain a mental health and justice advisory component to my practice. And just to bring it back to working with my grandmother and doing the work with Black Inmates and Friends Assembly, one of the things she emphasized was, understanding the intersectionality of mental health for her clients who are Black or racialized, and the need for Black and racialized clinicians, as well as culturally appropriate programming in the institutions. And then moving and using that as a segue to the next question in terms of how and what ways do the highlights and issues articulated and recommendations relate to my work and lived experience. When you think about the impact of this pandemic on persons with substance use needs and mental health issues, and then you also think about intersectionality, a lot of programming is community-based, and that was disrupted. And so, as you've mentioned, you're talking about populations that are incarcerated at a higher level disproportionately, that are Black and Indigenous, and they're now not getting access to culturally appropriate programmings, and that can be very detrimental to their mental health and mental wellness overall. Also, I'm glad that there's a focus, and there was talk about the need for a decarceration strategy. I think from my standpoint as a lawyer, there has been complacency creeping in terms of, you know, there was an initial push to get people out, especially, you know, thinking about the congregate settings, how quickly COVID could spread. I think there was an initial push to get people out, and the number of incarcerated persons did drop. But according to recent stats being released, and just anecdotally, we're seeing the complacency kind of setting in. And I think that's because a lot of us, you know, on the outside, you know, we're more comfortable. You know, we're being vaccinated. We're trying to get back to normal. And I don't know if we fully appreciate that COVID is still a very deadly threat for people living in congregate settings, you know, in institutions that were built in the 1800s with poor ventilation. You know, that urgency is still there to get people out. So we need to kind of keep that front in mind. And then also the need for enhanced discharge supports and supportive housing for persons with mental health and addiction, you know, or substance use needs. I mean, as a lawyer, I can say that the lack of it leads to further charges and breaches. So when people are released from jail and they're not being released because there, you know, there's been so much disruption in terms of housing supports because of the pandemic, and you know, we're trying to get people out. But if they're released and let's say they're in psychiatric crisis, that will lead to further charges and further problems. The other issue that I've come across is that you know, all of our business and service models have moved towards a kind of remote model, virtual models. But we need to think about the populations that we're serving, right? So if somebody is released from jail or discharged from a forensic hospital, and they're in the community and they need to do follow-up with their lawyer, with a service provider, how is that going to happen? You know, if mental health tribunals and other court matters are taking place remotely, you know, we need to ask ourselves, do they have access to the internet? You know, especially if they're already dealing with mental health and substance use issues. And then bringing it back to intersectionality, I was very happy, Dr. Bartram, that you talked and touched on like the elevated risks when you talk about Black community, when you talk about the Indigenous population. And I mean, that's for a lot of different reasons. And I think, you know, that's a lot to unpackage for this one talk. But we do know that there's worse, you know, there's comorbidities, there's chronic illness for this population. There's elevated risks for just people generally with mental health issues and psychiatric illness and people with substance use issues. So we need to keep that in mind. And I think we need to keep in mind in terms of the fact that they will probably have worse health outcomes if they get a contract COVID-19, or the community spread or the spread in their communities is going to be higher, right? So in Toronto, the Black population makes up 9% of the population. And after the first wave in that summer, we were seeing about 20% of cases were from that one group. So it was quite elevated. And I know there's similar statistics across Canada for Indigenous communities. So we also have to keep in mind that it's not just you know, the risks of getting sicker, it's also the transmission and the elevated transmission numbers we're seeing. And that could be because of socioeconomic factors. So when people are being released, where are they being released to? If they're getting released into like, you know, a household that has intergenerational housing and a lot of people in a tight setting, you know, the transmission can be higher for those persons or people with socioeconomic challenges. And, you know, I think something else to kind of keep in mind is that, you know, everything that happens inside in prison, and I think everybody that has worked, you know, in prisons or worked with people in jails will see that, you know, whatever happens inside is kind of a reflection of what happens outside. And quite often it's magnified. So when we think about substance use, it is a grave concern right now. You know, in Ontario, outside of prisons or just generally in the population, we saw that some opioid overdoses have gone up considerably. I think there's a stat I saw that it went up, overdose deaths due to opioids has gone up 75% since COVID hit. So I can only, I mean, I don't know the exact numbers, but that it's going to be seen in the prison population, especially when we're talking about people on extended lockdowns and very, you know, I guess, very adverse situations and conditions. So, you know, those are some of the things that I've saw that was talked about that I'd like to just expand on. And then lastly, you know, what are some next steps in terms of recommendations in terms of policy and further actions. I think, people that are released from jail, from prison, they need cell phones and they need internet access so that they can actually, participate in whatever further tribunals they have or legal matters they have, or even just to communicate with their crisis support workers or, social workers or other justice support service providers. I think something else that we can't forget is that, everybody's talking about this post-pandemic world. And, we're thinking about, leaving the city and people are working remotely. That doesn't necessarily work with this population. And we need to think about ways to get people comfortable. So like, service providers, lawyers, people need to get, family members need to get more comfortable with going back into institutions. And so maybe there needs to be literature and outreach to show that, like steps that can be taken to ensure safety in terms of transmission of COVID-19 and get people comfortable with going back into institutions, because it is very detrimental in terms of reintegration and people's mental wellness to have family members, service providers not there, and the programming to be limited. And then lastly, I think there needs to be information that's given, we talked about transparency, but information that's given about the vaccine to help, it has to be specifically designed for persons with mental illness or substance use issues. And it should be also culturally appropriate when necessary, to quell any kind of vaccine hesitancy. So we have to think about the kind of intersectionality too when we're sharing information with this population. So that's what I have for now.
Thanks very much, AJ, and welcome participants who are listening in to start thinking about their questions as well and putting those into the chat. Yeah, hearing some similar themes to what Mo mentioned in terms of, really that doing everything we can to support people who are making the transition back into the community, whether it's providing cell phones or what have you, the focus on supportive housing, some themes around, continuing the efforts to accelerate decarceration as well, in lockstep with strengthening those community supports for transition, and how the general trends around the intersection of elevated COVID risks and social determinants and racism and that disproportionate representation of Black and Indigenous people amongst those who have chronic disease, who are engaged in the criminal justice system, who have histories of mental health issues or substance use issues, problematic substance use. And that piece around, what can we do to support people to visit, family members, to get back into the visiting, but also to get culturally appropriate services back into correctional settings where there have been disruptions. Lots of really great reflections there, AJ. Those are just some of the ones that stuck with me. So if we could turn now to Howard Sapers and get his reflections, that would be great.
Sure. Thank you, Mary, and thank you, Mo and AJ as well for getting this conversation started so well. I'm joining the panel today from my home in Ottawa. It's my privilege to be able to live and work in the unceded territory of the Algonquin Nation. I thank the keepers of this territory for their stewardship. I also want to commend the Mental Health Commission of Canada for taking on this work and for organizing today's very important conversation. I looked at the three questions. Full disclosure to the audience, we were given these questions a few days ago. I looked at them and I took them as I took them under advisement as guidance. I'm not going to be as disciplined in my answer as both Mo and AJ were. I've made my career working largely in corrections, and it's been a long time, longer sometimes than I like to admit. And it's been characterized by trying to address the same problems over and over and over again. And this reality has plagued meaningful progress. There are still too many people going to jail, spending too long in custody, and not being properly supported when they are released. There's nothing new about this, and that's a tragedy. It's important that we use incarceration as the last resort that it is intended and in fact defined in law to be. And maybe COVID-19 is presenting us with a stark reminder of why that's just so critically important. The comorbidity of mental illness and addictions is overwhelming good correctional practice. In my memory, I have never seen populations this ill and dealing with such pervasive histories of substance misuse. And so it's really confounding what the purpose of our jails are, particularly for the sentence population. And that's another whole conversation when we come to the use of pretrial custody. And in fact, that most people who will spend a night in a Canadian prison or jail tonight are legally innocent of anything. Overwhelmingly, our custody populations are pretrial populations, and that comes with its own problems. The issues at the intersection of addiction and mental health, public health care, as I said, really aren't new, but COVID has brought them into sharp relief. These issues have defined my work for nearly 40 years. And as I say, it is the silver lining of this pandemic that more people are talking about this reality. They're thinking about these things. And so, as the cliche goes, we should not waste a crisis. There is an opportunity for real change and action. I want to remind the workshop of the panel today that back in 2013, the United Nations Office on Drugs and Crime, together with the World Health Organization, published a policy document called Good Governance for Prison Health in the 21st Century. So this predated COVID by a half a dozen years. And it was important because it was the first time really that this notion that prison health is public health really became cemented in the minds of policymakers. And I just want to take a minute. It's a great document to read. I commend it to you all. I just want to take a second and just share the highlights of 7 key conclusions in that document, because they're reflected in the work of the Commission, in the work that they're presenting today. So World Health Organization and UNDOC said, prisoners share the same right to health and well-being as any other person. They said prisons are settings with high risk of disease transmission. States have special sovereign duty of care to prisoners. Prison health services should be at least the equivalent professionally, ethically, and technically to those services available in the community. Prison health services should be provided exclusively to care for prisoners and never be used as punishment. Think there about the use of medical isolation during the pandemic. Prison health services should be fully independent of the prison administration, and prison health services need to be integrated into national and local health policies and systems. I mean, this has now become boilerplate advice, and yet so typically ignored in one way or another by policymakers, not just in Canada, but globally. So we have to be constantly reminded to do this and do it the way that we know will be helpful. When I was thinking about priorities, I thought, well, we've been given a pretty good roadmap in this policy document that we were just given a brief introduction to. The recommendations that have been made about screening thing, routine vaccination, integration of services, decarceration, transparency and information sharing. These are things that just need to be done, and they need to be made a priority in our provincial, territorial, and federal correction system, and particularly the integration with health serving providers in the community. And Mo's reminder of the good work that's done by community agencies, often underfunded, under-recognized, under-supported, but critical to the success of men and women trying to regain their lives in a safe and healthy ways. Decarceration is a real pressing issue. Globally, decarceration was the first response to COVID-19, except in Canada. While it is true that we saw some dramatic decreases in custodial populations, they were almost entirely in pretrial populations, which means that we didn't get the same decarceration benefit in the federal system, because of course, everybody's sentenced in a federal penitentiary, as opposed to the people that are being housed in provincial and territorial jails. A reminder that we have to target our programs to actual risks and needs, and we have to be particularly mindful of people's lived histories, including trauma, and the necessity to take a much more serious look through a trauma lens at how it is we're responding to people in conflict with the law. People have been talking for years about having more off-ramps or diversion out of our traditional criminal justice system. I'm at the point, quite frankly, where I think we need to be talking about roadblocks and not off-ramps. There's some people that should just not be put into custody because of their illness. And we need to make sure that we recognize people as patients first, if that's in fact what they are. So the best support, the best way forward, the best next steps really have to do with capitalizing on what we know. There's a tremendous body of work and literature about what works and what doesn't work, about how the system could be structured to better reflect our modern society, the digital world, the information age, cell phones certainly, but how about just access to internet? How about just something as simple as that, a national policy, making sure that along with guaranteed minimum incomes, we have minimum housing standards and minimum communication access standards as well. All of these things will actually make our communities healthier and safer, and these are things that actually operate outside of the criminal justice system. So as we proceed in this conversation this afternoon, I hope we can get into some more detail about how to deal with some of the particular stresses that are on carceral populations and the people that work in those facilities, and the best way to support them all for success, which is really about setting our priorities correctly and having the right goals in place for the system. So Mary, I think I'll stop my introductory comments with that, and really looking forward to the more richer conversations going to flow as a result of questions from the audience.
Thanks very much, Howard, for bringing that kind of broader policy lens and some of that international lens as well. Yeah, really, it just brings, to me, it's the, we know what to do. What are the barriers and opportunities for getting that policy shift, to happen? What are the critical factors? What are the entry points? What's the confluence of best ideas and evidence and the political stream? How are we able to get this moving, and the mix of some of those really pragmatic pieces, such as the cell phone access, with some of the more thorny issues, such as the integration with services outside of correctional settings, whether within provincial systems or community level organizations. So let's turn to some of the questions that have come in through the chat. I think I'll start with one for you, Mo, and certainly AJ and Howard, you're welcome to add in questions around what you talked about, Mo, about the importance of support for community organizations. Like, can you speak to how you were able to ramp up your capacity beyond the level that you were funded for? How did you manage to provide that much assistance beyond, over and above your funding level? And do you have any advice around securing funding from multiple streams, from multiple sectors, health, social services, as you said, First Nations Health Authority, justice? Do you have any advice or questions or reflections around how to strengthen that part of our supports for people who are transitioning back to the community?
Yes, for us, when our numbers soared, it's got to say, I have to take I can't believe it. I'm actually very impressed with what BC Corrections did here in BC. They're really focused on release planning, looking at everybody as individuals, and I'm really hoping this continues on, once, COVID resides. And for me, decriminalize, when we started mass releasing everybody in March, that's when our overdose numbers started skyrocketing. And I know lots of people are going to be shocked, but prison saved people's lives. It saved my life. I can show you hundreds of other people who say the same thing. It's a break. It's somewhere we get, food, clothing, shelter. We get dignity. We get a break from that lifestyle. And then all of a sudden we're released with nowhere to go. And that's one of the biggest issues, and the lack of support. BC here also has our provincial healthcare inside of our prison system. What's huge in the last 2 years, huge difference with our healthcare system. Really looking forward to the through care. So if you're on medication, you actually get back on that medication. The medication follows you out. So I think that's one thing that we should be recommending, that all provinces, hand the healthcare back over to. And as one of my colleagues said, they have to have the same healthcare as what we get out here in the community. So for us, yeah, when when the pandemic hit, we phoned all the correctional centers and said, we're here, what do you need from us? And we worked really close with healthcare as well. It's like, okay, how long somebody's been in, have they had COVID, because I'd keep my staff safe too, right? Have they had COVID screening? And for here in BC, most treatment centers don't take people until they're on the street for 30 days. That's common standard all the way around. What's somebody supposed to do for 30 days? And, the ones that do take people, there's a large wait list. So we definitely need to find, sending somebody to homeless shelter who just got out of prison isn't safe, right? We need to step up and have safe places for people who want to change their lives. Because I'm telling you, it's the hardest thing I ever did was that first year out of prison. My insecurities, feeling like everybody was judging me, and that's where our team comes in and walks beside, going to a probation officer and feeling like you're being judged, going to a doctor, feeling like you're judged, right? And having somebody walk beside you takes that pressure off, right? And gives people a better chance and shows them dignity, that there's somebody out here who does care, right? And the media, about homelessness and addiction, and it's a choice, and, then blah, blah, blah. And the other thing too is, we're 5 years into the overdose crisis here in BC, and the mental health that's coming out of this is unbelievable. People what I picked up 5 years ago are no longer the same people. If you're getting brought back, 5, 10, 15 times from, overdosing with no oxygen being to your brain. And that's one of the biggest things when COVID hit. You couldn't give breath because of COVID. So people are only going to get Narcan with no breath. Right? So the brain damage that's coming out of this is scary. right? And I think we're going to see, you know, in the next few years, really the effects from this overdose crisis. So, but yes,
Right.
we need to support community organizations who are out here doing this work.
Thanks very much, Mo. A question for AJ, I think, but feel free to pass it on if it doesn't fit for you. The Toronto Public Health Chair announced last summer that minor drug offenses will no longer be prosecuted in courtrooms. Will this be reflected in the treatment of prisoners, and will this influence any change to the current practice of prisoners being held longer and in higher security, or return to prisons exclusively for providing positive urine tests, particularly during the pandemic conditions that elevate the entire community's use of substances? And why are we still punishing prisoners for a mental health issue and making it worse in the process? Why can't we change this policy?
I think those are all very important questions. I'm just thinking maybe more from my policy background. You know, things have always moved very slowly in the justice system, you know, waiting for legislation to be passed, issues to be addressed often takes time. And right now, everything's compounded because of the pandemic, and things that just seem to make a lot of sense in terms of like COVID response, pandemic response, still take time, and we're all at a reduced capacity. So I think that is a part of it. But I also think, you know, thinking about what Howard said earlier, like, don't waste a good crisis when there's an opportunity in front of us. I think this is a great opportunity to kind of push government, you know, to make changes at a provincial level, at a federal level, these different ministries and agencies. We can really use this as an opportunity to push. And a big part of that is getting data. I think we all know anecdotally the problems. Again, just borrowing my experience working in policy at Legal Aid Ontario, the difficulty is in the healthcare and justice sectors, and then corrections. We need enhanced data. We need data that accurately reflects the populations that we're dealing with, so that we can make targeted programming and make policy changes. So it's one thing to kind of know these issues. It's another thing to actually have the information and data. And if I can just add to that, you know, when we're thinking about persons with mental health issues, or persons with substance use issues, and racialized and marginalized people, when we're asking for information, we also need to have some kind of scripting or informed scripting to get that information, because there might be hesitancy for good reason in terms of giving information and data to, you know, different government agencies or whoever the body is. So to have some kind of training in terms of scripting to get information can lead to better data for these marginalized populations. And I think armed with that data, it would be very helpful in terms of making changes on that kind of policy legislative level.
Mary,
great.
would you mind if I just added something quickly to AJ's, I think, very good answer?
I would love to give you that opportunity, Howard, but I was hoping that I could ask you instead to speak briefly to the last question we received from the audience, because we're almost out of time. Would that be okay?
Sure.
It's a question related to the potential impact of reduced uptake of vaccination within correctional settings, and also access to masks as we move into the fall and the potential fourth wave. Do you have any comments on or thoughts on what we might be able to do to ward off some of the risks there?
Yeah, well, so information is, you know, it's uncertainty. So when people in custody are being told that there's uncertainty about the either the efficacy or the safety of vaccines, they take that very seriously. The fact is that people have very little control over the health care they receive or don't receive while they're in custody. And so these concerns that may be important but smaller in the lives of those of us who are at liberty in the community become absolutely central to people's thinking while they're in custody. And so it takes a lot of work and a lot of effort and to deal with those concerns and those fears. Most correctional systems that I've been in touch with across Canada are actually making, I think, pretty good provision for PPE. So we've seen lots of procurement around masks, gloves, shields, gowns, disinfectants, etc. And also most of the systems, or in fact, well, all the systems that I'm familiar with, but that doesn't mean all of them across the country, have changed policy and procedure around hygiene, sanitation, cleaning, those kinds of routines. So there is this heightened awareness, which is good. The trick will really be keeping the pressure on. We can't get cavalier about this, particularly in congregate settings. So I'm feeling more optimistic than I thought I would be as we're looking at a potential fourth wave. But my biggest concern is just making sure that the vigilance continues and that there's some oversight. And I think this means, for the first time, having a much closer relationship between correctional authorities and public health authorities.
Thanks very much, Howard. Unfortunately, this brings us near to the end of our webinar. Could we just get the next slide, please? I want to direct people's attention to the Mental Health Commission's resource hub on the next slide, which is where you can find other policy briefs that we have worked on and will be releasing in the coming months, as well as a suite of resources. And if we could go 2 more slides forward. I just want to thank everyone who participated, who joined in, the panelists for their wonderful remarks. I think, you know, in a nutshell, the importance of continuing to keep the pressure on to bring these issues to the fore in whatever ways each of us can. We hope that the policy brief will be beneficial for people in their efforts to raise awareness about some of the emerging evidence related to these concerns. And if you have any follow-up questions or comments, please reach out. We would really love to hear from you. And thank you very much for joining us today.